If you have EKG issues, this is the clinical application is EKG. We are not just reading EKG, but I'm showing you how you can read the EKG and apply it. That's how the NCLEX will ask you. You can identify the EKG, but you don't know what to do. Therefore, pay attention and write some keywords. And next, provide care for a client with this rhythm on the cardiac monitor. What kind of rhythm? What is the next first action? What would you do when you identify this rhythm? First, will you provide immediate high quality CPR? Would you perform synchronized cardioversion? Will you assess for temperature? Will you administer methylpredol? What do you think? Now, let's look at the rhythm. First, how do you read the EKG? Look for regularity of the EKG. Is this regular? If it's regular, then that's not AFib or there's no block. And how do you check? You check from distance to distance, here to here. I know this is regular rhythm. Therefore, I know this is not AFib. Then I know if I can see the P wave. I can see the P wave here, but it's very close to the T wave. You see the distance? There's no breathing room, but it's not completely buried, right? It's not AFib because the atrium is there, right? It cannot be A-flutter because it does not look sawtoothed. They are close to each other, right? They're not completely buried. This is what we call sinus tachycardia. If it's almost completely buried, this will be what? SVT. This patient has sinus tachycardia. Therefore, if this is sinus tachycardia, what are you going to do? Sinus tachycardia does not need what? CPR. Sinus tachycardia does not need synchronized cardioversion. Sinus tachycardia may need methylpredol. Sinus tachycardia may need temperature to be checked. But which one would you pick? Clinically, what would you pick? You're going to pick temperature. Why? Because you want to know what is causing the temperature, the tachycardia to go up. There's three things that is common to cause tachycardia in the patient, sinus tachycardia. You can have pain issue, you can have IV fluid, or they're anxious. So figure it out before you give them beta blocker. I know a lot of people will pick number 4, but before you do that, you got to understand the underlying situation. Is it fluid problem? Is it pain level? Is it anxiety? Is it shock or something before you do something? First EKG question. How did you do it? I know you got it. What are we doing? And next, provide care for a client with what? Pneumonia. During which assessment, the nurse should recognize the rhythm on the cardiac monitor as what? We already seen this, but I'm just using it as a teaching. Pneumonia, infection. I have infection. Well, this is what I have. We saw. This is classic sinus tachycardia. It's the same question, but framing so that you can know this is the way it will be. It does not look like VTAC. We'll see VTAC if there's a question like that. Sinus bradycardia is too fast. Sinus tachycardia is acceptable. It's not SVT because the P and the T wave, I can see a dibble. They are not completely buried. They are not one, but this is okay. So this is sinus tachycardia. Which prescribed medication the nurse should recognize as the cause of the finding? What finding? And nurse perform medication reconciliation for a client with the electrocardiogram finding. This is what we find. What do you think? Electrocardiogram finding. So what do you want to do? This is the finding. And therefore, we're going to read it and figure out what kind of rhythm is that. You can see it's uniform from here to here. This is all uniform. So this is sinus. And I see this is very prolonged. The PR interval is too long. And this is so slow. So you can see this is bradycardia. But what is causing the bradycardia? Is it dopamine? Does it cause bradycardia? Is it bumetanide? Is that bradycardia? Bisoprolol, is it bradycardia? And benazeprine, is it benazeprine? Is it the one causing the problem? Then you got to identify what kind of medications are those. Then you can answer the question. Dopamine is dopamine for bipolar patient, for Parkinson patient. Therefore, it's not indicated. Bumetanide can cause tachycardia if you lose a lot of fluid. Is what? What do you think bumetanide is? Is what? Is a loop diuretic. The beta blocker would do this. This is ACE inhibitor. It does not affect your heart rate. And therefore, that's your right answer. But this is concept regarding EKGs. And this patient is in symptomatic. It's not symptomatic, but there's bradycardia. And this is consistent. PR interval is enlarged. This first degree. And next, provide care for a client with what? This rhythm. Client has no pulse. That's the key. Which action the nurse should take? I have no pulse. Which action should I take? Which action should I take? First, understand it. Am I going to what? Check the client pulse, immediate synchronized cardioversion, immediate high quality CPR, immediate defibrillation. What kind of rhythm is that? This is what we have. Same thing. You can see this rhythm is slow, is what? Sinus, and the heart rate is low. The PR interval is normal. It's not that fast like the one we saw. It's not that long like the one we saw. This is normal. Therefore, this is classic bradycardia compared to the other one with first degree. Now, if you know it's bradycardia, but what is the problem? He has no pulse. Therefore, it's not bradycardia. Bradycardia has pulses. This patient has no pulse. What will you do? This is what we call pulseless electrical activity. Once again, write it down. Pulseless electrical activity. That means your heart is giving you a signal, but it's not working. If your heart is not working, what is the procedure you do? Think about this as asystole. The heart is dead. What do you do for asystole? You don't do what? You don't check for pulse because the heart is dead. At the same time, I told you the patient has no pulse. Why would you check for pulse again? You don't synchronize cardioversion because there's no rhythm to synchronize cardioversion. This is a fake rhythm. You don't defibrillate because the heart is not pumping. You need to start CPR. So that's what you do for PEA asystole. It's a non-shockable rhythm. So write it down. PEA, non-shockable rhythm. Now, what should the nurse do first? First action. And nurse observe this rhythm strip on the client monitor during initial assessment. What is the rhythm? That's what we have. Think about it. We'll come back to it. Do you do CPR? Do you do defibrillation? Do you immediately feel for pulse in the carotid artery? Do you notify the healthcare provider? You got to read it. What is the key? When you read the EKG, first you see if it's a standard EKG. It's not. You see atrial rhythm? Not. These are all ventricle. Therefore, it's a ventricular problem. Is it uniform? Yes. It's not fibrillating, so it's not VFib, but it's a VTAC. Therefore, if it's a VTAC, what do you know? What do you do? What you should worry about? Because VTAC management is based on two things. Once again, VTAC, if you see a question on VTAC, is based on two things. Do you have a pulse or no pulse? Because if you have a no pulse, you considered VFib. If you have a pulse, then I want to know if you have symptoms. If you have no symptoms, I can give you medication. If you have symptoms, then I cardiovert you. This is the way you manage VTAC. This is the easy way I do it. You see, I've given you all the information so that when you see your question clinically, this is how you can approach it. Therefore, what do you think we should do? Which answer choice? We need to check a pulse to make sure patient is doing okay. How are you doing? I know EKG is troublesome. It may be intimidating to you, but you're going through the clinical aspect. You can watch this portion of the video multiple times until you master how to answer EKG questions on the NCLEX. Clinically, you can use this for ATI or SC exams. And these are key aspects of the things you should know. What is the problem? Order the steps the nurse should take based on the information provided. This is order steps. And then provide care for a client with new finding on the monitor. What kind of finding? Look at it. You look at the one that we saw, but this is different. It's fast rhythm. Number one. What number two? What do you see? Look for the P and the T wave. There is no, you can see that you only have one space here. This is not sinus tachycardia. This is SVT. That is the difference between the one we saw. This is SVT because supraventricular tachycardia, we have the atrium and the T wave, they all come together. There is no space. Therefore, this is SVT. How do you manage SVT is the question. What are your steps in the management of SVT? First, you got to go through the steps. Do you repeat the EKG? Do you repeat adenosine dose? Do you place IV in the antecubital fossa? Do you monitor the patient? You give them check for chest pain, give them adenosine over 1 to 2 seconds and flush it. First, this patient has to be on a cardiac monitor. So put on a cardiac monitor. Then you need the IV access so that you can give them the IV medication. Then you got to give them adenosine. So administer adenosine over 1 to 2 seconds. Then after that, you got to flush it so that it can go faster and it can stop the heart. Then you should monitor for chest pain. And everything is good, you repeat the next dose. This is the way you give adenosine. I want you to take a picture of it. First, know that you use it for SVT, and these are the steps you take to do medication, safe medication administration regarding SVT. And this is the explanation. The strip is SVT, and these are the things you do for that. Now, cardiac monitor showed the following rhythm. A nurse care for a client on the med-surg ward admitted for pneumonia, infection, reporting sensation of this fluttering, skipping beat. Why is my heart skipping beat? Is this AFib? Is this A flutter? Is premature ventricular contraction? Or is VTAC? This is EKG. Look at it. You can see there's uniformity. Then there's somebody pop out. All of a sudden, you start from here, uniform, and then this pop out. Then these set up and go back. It looks like AFib, but it can be AFib because you can see atrium here. Therefore, it's gone. It can be VTAC because you don't see uniformity. You can see atrial rhythm here. So this is not just a ventricular rhythm. This is ventricular atrial. The problem is this guy is abnormal. It's not supposed to be there. It's premature. It fire before the rest of them set up. So based on that, you can see it can be AFib because I can see a bunch of atrium. I can see atrium. A flutter, I don't see sawtooth information. VTAC, I see atrial information. Therefore, this has to be premature. You see how I read the EKG. Don't make it so difficult. Just step back, analyze it. You can see that you can master it. How are you doing? So far, EKG, right? And nurse enter a client's room when the rhythm shown below was observed. As soon as the nurse went in, the rhythm below was observed. The client is reading in bed. I'm reading in bed. I'm not doing anything. What is the nurse first action? What would you do? This is what you see. It's bradycardia, slow heart rate, very slow. What would I do? Do I give the patient atropine? Do I put transcutaneous pacemaker, pacing device? Do I ask the client how the client is doing? Do I give them metoprolol? This question is asking for specific things, is testing for specific things. What is testing for? How do you treat bradycardia? What do you think? Which answer choice would you pick? I want you to put down in the comment section and let me know. And also, I want you to tell me why you picked that answer choice. What do you think? This is Adapting Place. Thank you for watching so far. And in order to grow the channel, I need you to put a comment in the comment section and let me know how you're doing and let me know how the cases are going, how the questions are going, and what do you think you're going to put down for this answer choice. The key concept here is what? Bradycardia, we treat you with atropine if you have symptoms. If your heart rate is low, maybe that's where you live. So I need to find out whether you have symptoms. That's all. I don't pace you until I've treated you with something, or you're getting shock, right? The Ventricular is going to lower your heart rate more. Therefore, the right answer is assess for symptoms. Why? If I know that you're having symptoms, then I can treat your bradycardia. If it doesn't help, I may we will put a pacer device on you. If it doesn't help, then we do something else. But if I give you beta blocker, it's going to block you. If I give you atropine, you have no symptoms. These are the things you do first. Go through the motion, and then you can figure it out. Few more EKG questions. 67. After connecting the client to the cardiac monitor, the nurse recognized this rhythm. The nurse assessed the client in the emergency room. What do you think? You connect them and you see this. First of all, see if it's regular. You can see this is a regular. It's not AFib. See if you can see atrium. I can see atrium, but I can see it well because the atrium and the P wave and the T wave are buried. You see only one, not two. They completely buried. It can be sinus tachycardia because they completely buried. It can be VFib because I see atrial rhythm. It can be VTAG because I see atrial rhythm. It can be bradycardia because it's too fast. Therefore, what you left with? Supraventricular tachycardia. This is the way we read EKG. And this is the explanation for that. Same thing, we've seen this rhythm before. A nurse is assessing a client in the emergency room. The nurse observed the rhythm below on the cardiac monitor. Client has no symptoms. I see this rhythm, but I'm not having problem with it. There's a reason why I said no symptoms. It means something. What would you do? Adenosine, diazepam, metoprolol, or atropine? What would you think? This is what? SVT. What is the treatment for SVT? Diazepam, metoprolol, atropine, adenosine. Anything that will slow down your heart rate. Atropine will speed it up. Metoprolol will slow it down. Diazepam will slow it down. Adenosine will slow it down. But what do you use for this? The best answer choice is what? We've seen it multiple times. So let me know what you think. What answer choice did you pick? What answer choice do you pick? This is SVT, and adenosine is the most important medication. All the rest can treat it, diazepam, metoprolol, but the most effective way of treating SVT is to give them adenosine. Write it down. Don't forget that concept.